This is a man's world.
Fair is fair, right? Normally, Dr. DeRosa is on the show talking about women's issues. Today, she turns her attention to us men, specifically men's sexual problems. Good morning.
Good morning. So how did you draw the short stick to get this segment?
Did you have to put it that way?
Well, I guess we are talking about the male shtick.
Yes,
per
we
se.
are. This is going to be very fun. I can see this already. Maybe I should just listen to you and you go. But obviously, men can have problems with their plumbing at some
Absolutely.
point in life.
Usually when we talk about sexual dysfunctions, women have problems up in the brain where they lose their testosterone and they don't feel it. But guys typically always feel it.
Yes.
Sometimes the plumbing doesn't cooperate to their degree of liking. And what's interesting about the male erection, really it's multifactorial. In other words, you have to start with the foundation of testosterone. If you don't have proper testosterone,
Right.
nothing's going to work.
Which is such a big deal now that people are taking testosterone.
Oh, well, they're also saying that testosterone's the new Viagra,
Right.
but they're totally different. So,
Okay.
for instance, if you look at testosterone, it fires everything so it works properly. But the Viagra's, the Cialis, help blood flow. So if you don't have blood flow problems, you're really kind of wasting your time and money. And those drugs typically don't work as well unless you fix the foundation.
So if you have blood flow problems, could that be other problems as a result of other problems?
Well, certainly it's diabetes, high blood pressure, high cholesterol, smoking too much, so doing all that damage to the
Heart
body.
problems, maybe?
Well, it's actually a sign of heart problems.
Okay.
So if men have erection difficulties, it's often, you can find that there's going to be trouble for risk of stroke, heart attack, and other things.
Ouch.
I know, so everything goes by.
You mentioned women have the problem more up here, but can that also be a problem with men?
It absolutely can, because if their testosterone levels go really low, so for instance, most men should have a testosterone level of about 1,000 to 1,200. If you're down in the ones and the twos, not only is the plumbing gone, but also the desire usually goes too.
Really?
But if a guy's desire is gone, we know we're in serious trouble because the guys are usually on the prowl.
Right. So what do you recommend for guys who maybe have that issue?
Well, the first thing you want to do is make sure their testosterone levels are
Right.
proper. So you test the testosterone, get that replaced. If then you're still struggling with not as, the erections aren't coming, or they're not lasting as long, or they're just not as hard as they should be, then those drugs like Viagra, Cialis will work really nicely to help improve blood flow. But there's other things if those don't work as well.
Right. The testosterone is an interesting issue because a lot of people do it, and some doctors are all for it, obviously, and then some doctors suggest that maybe if you start doing it by injection or whatever, then your body stops creating it on its own.
Well, there is some truth to that, because as soon as I introduce testosterone, let's say we were to give you testosterone, your own body's production would stop because the brain is all of a sudden seeing something that it doesn't have to worry about making anymore. So it stops producing its own. So you really need to be making sure that you're treating at the right time. So if you're 20 years old, you shouldn't be getting testosterone replacement if you
Right.
have no issues.
Right.
But if you're 40 and 50 and you're already starting to drop really low, what's the point of staying really low? Your production is low and you need to have more. So my job is to give that to adequate levels so you can function and get your mojo back.
All right.
Not that you have a mojo problem.
What is this about penile pumps?
Oh, the dreaded penile pump. So certainly if the Viagra's, the Cialis's, the testosterone, all else fails, you have other options. So the penile pump is a surgical procedure where a pump can be inserted,
Okay.
and that can be used as needed to help with penile erections. But there are also other ways aside from the pumps. You have injections, and also there's gels that can be inserted into the urethra on the penis that helps with erections as well.
That doesn't sound pleasant.
But the gel's not so bad. The injection, most men
That's what I was
fear
talking
the
about.
needle near the penis.
Yeah, all right. You've got an event for women coming up, a hormonal happy hour. What is that all about?
Well, it's designed to be a fun educational place to learn about love and libido, and we're doing it at Fleming's in Chandler.
Okay.
And it's for women primarily to talk about what drives libido and get that feeling back for the special
Maybe
person
if
in
you
your
would
life.
allow guys to show up, they could be more excited.
Usually it's the guys aren't the trouble. It's the women.
All right.
But you could learn a lot. You might want to show up.
I think I'll stay a long way away.